The number one thing you might not realize: choosing the right LLM, open or closed weight, could be the difference between a breakthrough and a compliance nightmare. If you work in biotech, here's what actually matters. Who controls the model, you or the vendor? Because speed means nothing if your data leaks. Accuracy means nothing if your IT team blocks it. And hallucinations? They'll wreck your FDA submission. Biotech teams need one thing above all, and that's control. That means understanding the three model types. The first, open weight models. For example, Llama 3 and Mistral. They're self hosted, tunable, and private, ideal if you want full sovereignty. And then there's private, closed weight models like GPT-4b Micro. That was used by Retro Biosciences in a previous episode. We talked about that. These aren't open source, but they're secure, they're domain tuned, and usually vendor managed. Sanofi's internal AI development pipeline is another example of a private closed weight model. Then there's public black box APIs like GPT-4, Claude. These are fast and powerful, but they offer zero visibility into what's under the hood. These aren't hypothetical, they're in play. OpenAI helped fine tune GPT-4b Micro for protein engineering in a specific task for Retro Bioscience. Sanofi, OpenAI, and Formation Bio teamed up to build their own internal AI models on Sanofi's proprietary pipelines. These models are not open source, and they reflect a private, closed weight approach. But there's this shift most biotech leaders are missing. If your LLM generates data that ends up in a regulatory filing, the FDA will eventually want to know how it was trained, how was it validated, and monitored. This isn't speculation. It's here, black and white, in the FDA guidance. Quote, sponsors should assume that regulators may ask for internal details like parameters, validation, and drift monitoring. End quote. And it's not just for big pharma. Any startup or mid-sized biotech submitting AI-derived data for an IND or BLA could face the same scrutiny. If you're in upstream discovery, then yeah, there's more flexibility. But once AI outputs touch clinical or regulatory claims, it's a different game. These models are no longer just tools. They're scientific instruments with SOPs, assay ID, and audit trails. So here's the bottom line. If your LLM is even close to generating clinical content and it can't be hosted, inspected, or tuned by your team, it can't be trusted. In biotech, black box AI isn't just annoying, it's dangerous. I'm Dan Ryder from Bridge Informatics. This was Informatics Insight.